Hello, my name is Jan O'Neill and I'm a community coach with the County Health Rankings and Roadmaps program, and I'm joined by my colleague Mary Bennett.
Hello all. Big welcome to each and every one of you today. I'm sure you're going to enjoy this wonderful webinar. I'll be chatting out links to you throughout and responding to questions.
Great, and we're excited to have Kathleen O'Brien and Jaime Lederer and Edwin Argueta with us today to talk with us about how they're working in Everett, Massachusetts to address issues of racial justice, immigration, and assimilation through innovative ways of engaging community members. Hello, everybody.
Hello.
Hello,
Great to be everybody.
Here. Great, thank you so much. So, first, before we get started here, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute, which is here where we're based, Mary and I, in Madison, Wisconsin. And next, we want to just take a quick moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window where you'll see our screen throughout the presentation. And on the right, you can see the control panel. You can also interject chats if you like, and Mary will be chatting out to all of you. And so that's the place you can send us questions as well. So here's a look at what we're going to talk about today. We'll start with a brief overview of the County Health Rankings and Roadmaps program to help set the stage for our topic today. And we'll also highlight a couple of tools from a new key activity we've added to one of our guides. We'll then talk with Kathleen, Jaime, and Edwin about their work in Everett, and we'll be sure to take time for your questions to help you put this information to use in your community. And we have shared your pre-registration questions with them as well, so hopefully we'll be able to get to some of those. And then we'll wrap up with ways to stay up to date with County Health Rankings and Roadmaps developments. And at the top of the hour, we'll wrap up the webinar, but for those of you who would like to continue some Q&A with our guests, we'll keep the platform, the GoToWebinar platform, open for an additional 15 minutes or so. So we will have additional time with our guests if you'd like to join us for that. This question guides our webinar today. And we'd love to hear your examples, so please use the chat or question box to share with us what's worked well in your community. And be sure to include your community so that we can share it with others on the webinar. And feel free to share your examples as we go through these next slides. So the question is, how can communities address potential racial and social justice issues through community engagement? As we move into the content of the webinar, we'd like you to consider these questions as you listen. Who else do you need to share this information with? What's one idea for action that you're taking from this webinar? And what else do you need to know to take action and use this information? So I'm going to just pause here and let you all know that Mary is receiving things that, examples from your communities, and she'll be chatting those out to all of you so you can see them in the chat box. We want to make sure there's also plenty of time for our interview. But this part of our webinar, we're just going to give you a brief program overview to ground our discussion of County Health Rankings and Roadmaps, and it'll take about 5 minutes. And if you're newer to us, this will give you a sort of high-level overview of County Health Rankings and Roadmaps. And to learn more, we really encourage you to check out one of our Rankings and Roadmaps 101 webinars. Starting from the top, the County Health Rankings ranks the health of nearly every county in every state, and for each county you'll find two rankings, one for health outcomes and one for health factors. And what you're looking at here on this image shows the relationship between policy, health factors, and health outcomes. It illustrates why it's important for communities to take a broad definition of health. Many factors impact how well and how long we live, and things like how we commute to work, housing conditions, access to parks, the quality of our schools, access to healthy foods, community safety, and our social connectedness all impact our health outcomes. So what does this really tell us, this image? Starting from the bottom, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. And there are many health factors that help shape our community's health outcomes. So we look at health behaviors, clinical care, social and economic factors, and the physical environment. And we measure two types of health outcomes to show how healthy each county is, the length of life and quality of life. Now, this is challenging work, and we know that communities sometimes want or need support to figure out first or next steps. So with that in mind, let's take a quick look at the Roadmaps to Health Action Center. This is the take action cycle, and it is the how within rankings and roadmaps, if you think of rankings as the what. And it lays out a process that communities can follow to improve their health. It includes guidance and tools to help communities keep moving along this cycle. And Mary's going to be sharing out some links to some tools along the way during this webinar that comes from our Action Center. These will also be posted online later this week with this webinar. So, today's webinar actually focuses on work together, and you'll see this is sort of outside of the cycle. Work together is up here, communicates down here. These, the guidance and tools for these sort of live all throughout the cycle. So let's go in and take a look at work together. If you click on Work Together in the Action Cycle, you're led to this page on our website, and it provides you guidance on how to build and sustain partnerships that reflect the diversity of your community. And you'll see on that page also key activities with several categories of tools, and our updated site is going to be released on March 16th. So you're going to see a new category of key activities that are very relevant to today's conversation. And this is Work Together to Address Health Inequities. And when you click on that key activity on our new site, March 16th, you're going to see one of these, you're going to see this page. And we'd like to highlight a couple of tools that you'll find when you get here. So first of all, our newly released Health Gaps Report, which can help you raise awareness about what drives differences in opportunities to be healthy in your state, and a Health Gaps Report discussion guide that provides guidance for having those conversations. And another tool that we'd like to highlight is one that's been on our site for quite a while, but hopefully it's a little bit easier to find with this new key activity, and that is the Action Toolkit to Advance Health Equities. And when you click on that, this is what it looks like. It's from the makers of Unnatural Causes, and you can use the series to educate, organize, and advocate for changes that will really make a difference to improve health equity for all in your community. There are other tools associated with this new key activity, but these are just a few that we wanted to highlight for this webinar. And going back to the site, again, we also have the RWJF Culture of Health Prize. It's another rich resource for communities for stories about who's working on health and equity and really engaging their communities in meaningful ways. The prize celebrates what communities have done as well as how they've done it. So you'll see here the 6 criteria that are central to the Culture of Health Prize. And it works, the prize recognizes communities once a year who work across all the health factors by defining health broadly. And these are communities very strategically focused on policy and systems and environmental change, as well as programs. And these are communities who look out for all, including the most vulnerable, and really collaborate with residents, collaborate with partners from across the sectors, and use resources wisely and creatively, and they measure and share success widely. So Mary's chatting some information about the prize now. So without further ado, at this point, I would now like to welcome Kathleen, Jaime, and Edwin into our conversation and give you a little bit of introductions. So Kathleen is director of the Everett Community Health Partnership, which is a coalition of groups committed to raising the bar on health in Everett. It was launched a decade ago, and the coalition focuses on the links between health and factors such as racism, income, jobs, education, and housing. And prior to serving as director of the partnership, she was the Mass in Motion coordinator for the City of Everett's Energize Everett initiative. And Jaime is coordinator of the Substance Abuse Coalition for the Everett Community Health Partnership, where she provides leadership for Everett in youth development and programming opportunities to address substance use, prevention, leadership development, community change, and health equity. Edwin is a Salvadorian immigrant and is one of the immigrant workers' rights organizers for Massachusetts Jobs with Justice, with primary responsibility for immigrant rights and workers' rights work. And Edwin is president of the board of La Comunidad, Inc., and has been active for many years in the immigrant rights movement and organized labor as a service provider, advocate, and organizer. So welcome everyone, and I think we're going to start with Kathleen.
Yes, hello. Welcome, everybody. I'm going to give you a little background about,
I'm sorry, I stepped on your line.
Oh.
Hi, Kathleen. I was just going to ask you to sort of set the stage for us a little bit about Everett. Yeah, sorry about that. Go ahead.
Quite all right. Yes, so Everett is a densely populated city. We are a post-industrial urban fringe city. We're located just outside of Boston on the Mystic and the Malden rivers. And according to the latest census, our population is about 42,000, but some estimate it to be much larger. 2 square miles are residential of our city, and the rest is occupied by light and heavy industry. And we're a gateway community. We have the 3rd highest number of people in the state born outside of the U.S. And while we've always been home to immigrants, traditionally from Ireland and Italy, within the last 20 years, we've seen our population become much more diverse, with many emigrating from Latin America, Haiti, Africa, and the Middle East. And as you can see by this chart here, our foreign-born population has increased since 2000, and it's much higher than the state average. And we have more than half of our population speaking a language other than or in addition to English. And the top 5 languages other than English are Spanish, Portuguese, Haitian Creole, Italian, and Arabic. The median household income has decreased slightly since 2000, and renter-occupied housing has stayed about the same, but it's still well above the state average. And the number of students who receive free or reduced lunch has increased and is also well above the state average of Massachusetts. And some, like many communities facing demographic and economic shifts, we work to really focus on balancing our assets and our challenges. And our assets are really rooted in our long history of collaboration and networking among multi-sector groups and building strong relationships with community leaders and residents. And the fact that we are really working to recognize and embrace the changes facing our community is a big part of our work toward creating One Everett. And we'll speak to some of these points in more detail in the following slides. For our challenges, we believe that some are inherent in many small, lower-income, diversifying communities, and some stem from working to move from an industrial past to a more robust economic landscape. In terms of health indicators, the leading causes of death among Everett residents are heart disease, lung cancer, mental disorders, and respiratory disease. And while the leading causes of hospitalizations are related to diabetes, COPD, circulatory diseases, and mental disorders. And while many of these are commonly referred to as lifestyle diseases, our work really focuses on reducing these by working in a systemic fashion and enhancing the social and economic factors that contribute to good health. And another challenge that we face is, as a small community, we have to deal with competition over resources. So this is why we work within our coalitions and other multi-sector collaboratives to try to alleviate some of this competition. And a more recent challenge is economic development. As our city was just awarded one of 3 gaming licenses in the state of Massachusetts, and a major resort casino will be built in Everett upon a parcel of land that has laid barren and contaminated for the past 30 years. And it's spurring a lot of other development, such as luxury housing and hotels and other amenities that may appear at first glance to be good economic development strategies, but our lower income residents are already beginning to feel the effects of gentrification. And again, as part of a rapidly diversifying community, communication is tough as we have many residents who are not speaking English only. And many of our partners are really working to provide multilingual services, but there's still a lot of work to be done.
So, Kathleen, there's some significant events that led to your focus on health inequities. Could you talk about these and how that shaped the work that you're doing today?
Yes. So as we mentioned, recognizing the diversity and the demographic shifts has really led to us using a kind of data-driven community health improvement strategy and creating these multi-sector collaborations in response to some of these turning points, these community issues, and really engaging those most affected by the problems and finding the solutions. So one of the first turning points that led to our focus on health inequities was in the late 1990s when a student at a local elementary school broke her arm, and her teacher realized that her family did not have health insurance and they did not speak English. So with support from the city and the public schools and many local partners, they began an organization called the Joint Committee for Children's Health Care in Everett with the explicit mission of providing multilingual healthcare access services. And to this day, they have staff who speak the 5 major languages in Everett and are still connecting folks to health and social services in the community. Another turning point was in 2004 when a young Latina woman drowned in the Mystic River. Quickly realizing that there were no signs in Spanish prohibiting access to the river, a local police officer, teachers, state legislators, and our local Latino Community Service Agency began the Multicultural Affairs Commission, which began to meet regularly to discuss important issues facing the immigrant community. And this group has worked with the ACLU to investigate traffic stops, which led to immigrant police community forums and the creation of a multilingual brochure on what to do if stopped by the police. And they've also worked with Vanderbilt University students to document fear by the Brazilian immigrants of immigration enforcement and the effects of stress on immigrant health. So this work has really led to us beginning to talk out loud about racism as a stressor and a determinant of health. And we began holding informal discussions of racism and its ongoing effects. In about 2010, we received a grant that really formalized this work from the Boston Public Health Commission to explicitly focus our food access work around health equity and racial justice. And we became part of a New England-wide collaborative, learning how to name racism explicitly, but not exclusively, as a determinant of health, and learning how to communicate that to others. And the difference of this project, as opposed to any others, was that it focused on the entire spectrum of racism, structural racism, systemic racism, interpersonal, and how whites and people of color have different roles to play in really working toward racial justice, and how white privilege contributes and perpetuates racism. So this grant really launched a lot of the work that we've done since then, including how we've revisioned our community health partnership to explicitly include health equity and racial justice in our mission and vision.
That's a great segue. Thank you so much for laying that groundwork, Kathleen. So Everett was recognized in 2015 as an RWJF Culture of Health Prize community, and a big part of that was how well multiple sectors work in your community, work together to create better health. So you've mentioned a couple of times your partnership. Can you tell us a little bit about your partnership and your approach, please?
Sure, yeah. Our partnership began when our local hospital, the Whidden Hospital, was sold to a regional healthcare system called Cambridge Health Alliance, which is where Jaime and I are currently employed, CHA for short. And part of the agreement of the sale was for CHA to conduct a community health assessment. And it found at the time that substance abuse was a very big problem in the city. So these findings led to the creation of the Everett Community Health Partnership Substance Abuse Coalition, which is a multi-sector coalition working to reduce substance use in youth and over time in adults. and this group is still in existence today, and Jaime will speak specifically to some of their youth-focused efforts. And then starting in 2005, we realized that there were other health issues in the community that need to be addressed, and so the Everett Community Health Partnership was formed, also led by the Cambridge Health Alliance. Today, we exist as a multi-sector partnership. We have an 8-member steering committee. We have about 30 partners from around the community, including the City of Everett, community-based organizations, public safety. A few of our partners in the photo previous to this slide was from the Robert Wood Johnson Culture of Health Prize celebration, and they're from La Comunidad Inc., the Joint Committee for Children's Healthcare, the Substance Abuse Coalition, and the Everett Haitian Community Center, and Energize Everett. And excuse me, I'm just coming down with something, so excuse my coughing. And as I had mentioned, we've spent the last year really revisioning our partnership to focus on health equity, and our vision now specifically includes working to create a safe, welcoming, just, and equitable Everett for both long-time and newly arrived residents, and includes this broad definition of health at the end there. And our mission stresses collaboration, working towards systemic change. This year we're beginning a process where all partners will be taking a Health Equity 101 training, and we're offering this 2 times a year. And we're going to be using a racial equity impact assessment from the organization Race Forward as we hone in on our focus areas for 2016 to 2018.
Kathleen, this is Jan. There's a question that came in.
Sure.
Somebody is wondering about the percentages of both Black and Hispanic Latino populations. Do you know
offhand, I know that we don't have a very large African American population. In terms of Hispanic, I want to say it's about 30%. Jaime or Edwin, do you have that off the top of your head?
It sounds about right.
I think it's about 30% who speak Spanish.
Okay, thank you.
I did, you know what's fine, I did have the percentages right with me, and then this newer version I don't.
Okay.
I apologize, but I can definitely get that to them. And then we also have our health assessment, which will be showing up here in a moment, and they could click on that, and that has all of our data.
Oh, right, good point.
Look at that.
There you go.
Good timing.
Like magic. Yeah.
Yeah, so this health assessment really is the groundwork of our improvement efforts, and we collect and share data with the community. Every 5 years, we conduct this community health assessment with local partners, and we use an evaluation team that looks at health indicators and social determinants of health. And we use these findings to guide our work. And we've recently, in this edition here, we just started looking at the social determinants, and we've included a section on racism and health. And for our priority focus areas, again, we use our health assessment to kind of look at the top health indicators, but then as Jane had mentioned earlier, we're looking at kind of these root causes and these social and economic factors. So for our partnership in particular, the 3 biggest challenges and issues that are coming up with our residents are housing availability and affordability, economic stability, and opportunities for children, families, and youth. And a lot of our funding focuses on these health behaviors, you know, this top right, health, tobacco use, diet, and exercise. We've realized that we need to change those bottom layers in order to really make these changes last. So we work to really find creative ways to address the root causes in order to get those health behaviors reduced, you know, the poor health outcomes reduced.
Kathleen, this is Jan again. A couple of questions here. One is you mentioned that the dot points to the right, these are the things that are the, you know, root causes in driving social and economic factors, and this is what the community wants to work on, right?
Yes.
And so how do you balance that with, you mentioned that these other things are what's getting funded, plus maybe your data didn't point to these things. How do you balance community voicing, this is what we want to have changed?
Right. Well, I think that we've learned, you know, through having this grant from the Boston Public Health Commission and kind of learning how to frame the data with a health equity and a racial justice lens, showing that, you know, if these bottom factors are not addressed, then the top factors cannot be addressed either, because they're often associated. It takes, you know, logic models and diagrams sometimes with the funders. If we wanted to, you know, something that we've been doing that Jaime will probably talk about is the youth police dialogues, and, you know, she's funded through substance abuse, you know, a lot of tobacco funding and alcohol and drug use funding, and to really create the links and say having these police youth dialogues does affect, you know, the number of substance use and tobacco use, because, you know, the youth are feeling more comfortable in the community. Yeah, it's just it's being creative and, and working in our partnerships and really pooling our knowledge and our resources together.
Well, thanks so much. I said I had a couple of questions. We'll actually save them for the
Yeah.
Q&A, I think. So, you know, if you could just talk a little bit about, very briefly here, community engagement. I know this was one of the key strengths recognized by the Culture of Health Prize committee. And why do you think this was singled out? What are some of your key activities around that?
Excuse me. And again, Jaime and Edwin are going to be able to get into this in a lot more detail
Right.
than I will, but kind of the evolution of how we've been working. You know, our history of working collaboratively has really involved all levels of the community, but it's traditionally been led by community leaders of service providing organizations, the cities and the schools. But recently our focus on community organizing and really getting out there and talking to residents and engaging youth and different residents has really highlighted a new level of leadership in our youth and our immigrant communities. And
Great.
some of our key activities, I just have some images up here on the
Yeah.
next slide. Just some fun things that we do and that we've done. That middle one is actually from the Robert Wood Johnson Culture of Health Prize site visit. We had 45 people in the room. It was a lot. It was way more than we expected, but so many people in our community wanted to contribute and talk about our health improvement efforts. And we do data presentations. We do outreach at events. Police, there's some pictures of the police and the community working together, some of our strategic planning, things like that, youth rallies. And again, as I said, I really want to allow Jaime and Edwin to speak to some of these activities in more detail.
Great. Thank you, Kathleen. So, Jaime, turning to you and you know, your focus on youth involvement in health, can you tell us a little bit about what you've done and who's been involved and what you've seen change as a result? Jaime, I think you have to take yourself off mute. Oh, Jaime? Okay. Well, we had Jaime before, and now
Hello?
there she is. Great. All
My
right.
apologies.
No problem.
Several different buttons can mute me, apparently. So thank you for having me today. Hello, everyone out there. When the Substance Abuse Coalition was founded as a way to really engage all the different sectors of the community, there was a huge focus with youth, and that's when TISA was born, which is Teens in Everett Against Substance Abuse. And this group really formed by youth leaders from Everett that identified and named substance abuse as a really huge problem. And there were very few options for teens after school, aside from some after-school sports. Sometimes just when it was getting launched, 60 teens would come to meetings and just kind of an empty room in City Hall. And so now in its 11th year, TISA's continued to be a community-based youth program that focuses on substance abuse prevention and youth leadership. The coalition really prioritized youth in its efforts to reduce substance abuse and focus on prevention overall. And as I said, youth have always been at the forefront of the coalition's work and been involved in many community activities and events that focus on substance abuse prevention, but also address issues that impact youth in the community that they identify. And they've been involved in advocating for more programs, for jobs, other opportunities, in addition to health policies. And they've really been at the table around some important health policy changes at the local and state level. So we've worked with the public schools very closely and continue to administer the Youth Risk Behavior Survey every 2 years for grades 6 through 12. And engaging youth in this data is a really great way to look at perceptions of youth and for identifying areas for improvement. And now that we've collected trend data for more than a decade, we can really see where coalition activities and initiatives have had positive impacts and ways we can engage other community organizations, institutions, and our city leaders. By having youth understand community health data, they can create important and meaningful dialogue with their peers and community leaders. Often we hear, everybody's doing drugs or drinking on the weekends, but the reality is that that's not the case, and they can help launch that dialogue with evidence-based and data. Youth can be part of the efforts to change community norms and perceptions. This showcases all youth leadership. Elevating and empowering youth to use their voice can be instrumental in community change and health
improvements. I'm sorry, I'm going to stop you there, Jamie, just for a second. There's some background noise, and I'm wondering if it's in yours or...
No.
I don't know. Okay, so let's keep going. There's somebody's background noise. Let me stop it. Okay, I'm sorry. So let's pause here for a moment. And am I on the right slide for you two?
Yes.
This the slide? All right, perfect.
That's fine. We'll stay here for a moment.
Back into the webinar. Okay, there you go.
So elevating and empowering youth to use their voice can really be an instrumental community change effort in health improvements. They can lead change efforts that affect community norms and policies that encourage poor health. So in 2010, one example is that TISA leaders advocated for a ban on the sale of tobacco at our pharmacies. Everett was one of the first places to pass a pharmacy sale ban, and now we've seen this trend go across the country and with corporate pharmacies as well. And we've really seen tobacco use rates plummet among Everett youth. And this has really been an important focus area throughout TISA's formation, as we've seen, high rates of lung cancer and other health issues related to smoking. So we can have a really positive and proactive impact in changing the health of an entire generation. So also, it's been important to connect youth to resources in the community. And we work with youth and community leaders to engage in these conversations. And this increases access and information, as well as understanding and mutual respect. Can we stay back on the other slide for a moment?
Sure.
These opportunities begin to change perceptions about youth in the community and identify ways everyone can work together during challenges and celebrate community accomplishments. And so I just wanted to highlight the bottom photo here is actually from one of the youth police dialogues that we held. The police department has been a strong partner of the Substance Abuse Coalition's work since its inception and really been there to support TISA and interested in our work in youth development in the community. So when concerns arose on a national level about police brutality and community violence, it was really important to bring our youth and police together for an intentional dialogue to build relationships and understanding. And so we held these dialogues that really focused on building bridges to have difficult conversations. And in order to do this, it's really important to create something interactive that begins with low-risk activity. And so we start with a warm-up question, say your name, and a word to describe Everett. And this way, from the beginning, we can all demonstrate our own perception and relation to the community, building a relationship among the group. I like to create these activities that help remove the uniform that the police might have or the youth might have, and begin to see that we're all here because we care about Everett and we care about our community. And so having them group up maybe by favorite sports team or the month of birth, something that can begin to build towards a way to have deeper, meaningful conversations. So that happens, when you have a police officer and a youth high-fiving about the Celtics game last night, it's more likely that then they will begin having a deeper conversation about why they're there to discuss important issues that youth face. We've got to create safe spaces for dialogue, and elevating the youth voice can showcase positive activities that youth are engaged in developing our future leaders. And
So,
so,
Jamie,
yep,
we have a
yeah,
question that came in. This
sure.
is Jan again. So you talked about tobacco use is going down, and how do you measure that?
One of the really important factors is through our youth risk behavior survey, and so this survey is administered every 2 years, grades 6 through 12, and it is self-reporting, but we have data now that shows over the course of more than a decade, the rates continue to go down, and it asks questions about lifetime use as well as current or recent use. So that's one way that we are able to measure tobacco use. The YRBS, which is what it's called, measures risk behaviors and protective factors in youth among many different um, health topics as well.
Great, thank you. So I'm going to go to the next slide.
Yeah.
Okay.
We've done a lot of great things to reduce substance abuse and use among teens in Everett, and it's still our main focus. We still have work to do, but youth are engaged in this work. They begin to connect the dots and understand that there are additional factors that might influence substance use, like what Kathleen has really talked about relating to employment and housing and more. And so our youth participate locally and regionally at community events and statewide when there are opportunities to meet other youth from the state, because there are other youth that care and want to be involved, and it's important for them to build relationships on a state level as well. And so just last week, we visited the State House to advocate for changes in policies and budget related to youth jobs, which is a really important piece in Massachusetts funding for summer jobs for our communities. And
Jamie, there's another question that came in as well, going back to the slide about the police officers. Are they given equity training prior to conversations with the youth?
I'm not completely familiar with our police department's professional development, but I know that our chief has really been focused in creating a police force that is representative of the community and working to address a lot of the issues. And as partners in this work, we continue to build that understanding. And I don't know if Kathleen might be able to speak to that a little bit more, maybe at the end. I just wanted to wrap up one other important point is about building the Everett Youth Network. And that's also part of, the police are involved in this in addition to many of the other partners. And it's to create this, the network brings together service providers, youth workers, people who work with teens regularly and are able to identify issues of concern. We connect really to build support for one another, build our relationships among those who work with teens so that we know that we're not doing this alone or in isolation. It can feel that way sometimes. We begin to share a language of understanding around prevention, be allies, and elevating youth concerns in the community. Collaborate when possible, but really know that, again, we're there to support one another and not compete for resources, but how can we elevate youth voice and the youth concerns to make it a safe place for everyone to grow up. And so we're building the youth capacity for growth and development in the community so they can be the future leaders and representative of Everett in this changing time for the community.
This is so exciting, Jamie. Thank you so much for sharing this.
Thank you.
Yeah, this is great. And hopefully I know we will have time for questions. Lots of questions coming in. So I'm going to move now to Edwin. And then Edwin, we'd love to hear about how your approach is shifting power dynamics to better integrate voices and priorities of communities of color. If you could talk to that a little bit.
Sure, and thank you for having me speak to you today. So I think one of the things that we have realized in order to make Everett a healthy community, it's that one of the other big factors or tools that we have utilized is community organizing, and to recognize that it's an important tool to to create social change. Um, you know, um, like Jamie and Kathleen have alluded to, Everett has gone through very significant dramatic changes in the last 20 years. And our own immigrant communities have founded their organizations in order to respond to some of the challenges and opportunities. Comunidad Inc., for example, has been one of those organizations that has been around the city for at least 15 years, providing ESL classes, immigration services, even basic questions around how to navigate the public schools, et cetera, et cetera. But I think what's also important to understand is that, organizing is a process. Things do not happen overnight, and by this process, we try to create spaces. We try to create bridges. We try to create safe places for people to come to and try to come up with ideas and solutions in order to create a stronger fabric for what the community, should look like. And like Jaime and Kathleen have been talking about, out of unfortunate situations, we have been working and trying to create, positive outcomes. And therefore, there has been unintentional evolution of those spaces to things like, the Multicultural Affairs Commission, the community dialogues about, who the immigrants are in the city, to what now has become a strong, multi-layer coalition, that we call One Everett, because that's the image that we want to have. That's the community we want to have. We don't want to have a community that is just, the lone timers that have been living here, they arrived from Italy and other countries, half of a century ago, but also the community that is, now mostly made up of Brazilians, Haitians, Latinos, and folks from different Arabic-speaking countries. We believe that, these spaces help us, talk about the difficulties, in terms of language and in terms of understanding, what the role of the police department is in the city. By this safe spaces, we have been able to focus our energy into learning about, what are the challenges on a day-to-day basis, that our residents, have, are going through. So we're very excited that we now have something like, and you've seen some of the pictures, of some of the One Everett activities in terms of bringing folks together and even having basic one-on-one conversations with our neighbors. What do you like about the city? What don't you like about the city? How can these things be improved, and how do we make that happen? And they, some of the activities we probably see in some of the slides include having conversations and engaging in conversations with not only leadership in the community from organizations that are trying to provide some of those services and meet the needs of the new immigrant population and others, but also how do we engage with elected officials that are making some of those decisions, for everybody who lives in the city of Everett, given, the challenges that we're facing right now in terms of housing, in terms of, jobs, in terms of, the resources that are needed in order to make, a decent way of living in the city. Yeah.
Wow, thank you so much, Edwin. So lots of questions coming in. Let me just go to very quickly the, lessons being learned. Is there anything any of the three of you want to comment on this particular, these points that you put together, or do you think they kind of stand alone as they are? And I'll just step back and see if you want to add anything to this, any of you.
I think this is Edwin speaking again about a community organizing. I think one of the things that we understand is that yes, you have collaborations, you have partnerships, you have ideas, you come up with plans, but all these things are not enough if there isn't buy-in from the community residents themselves. You can make, all kinds of great plans in the world, but if you don't involve people and meet where people are at, it's only theory, right? And you have to make sure that there's a combination of practice with the theory. And meeting people where they're at is very important. It's a very basic, organizing, activity of learning who is living next to you and what are the challenges and opportunities that that person with his or her family may have. And you realize that it's very similar to the things that you're going through in a community like Everett.
Right. This is Kathleen, and Edwin and I were talking about that, and it reminds me of last summer through One Everett we did door knocking. We did, Edwin, how many streets did we do? Maybe 6 streets.
Probably
Both
more.
sides of
Probably
the
about
street.
eight streets.
Yeah, and they're long, long streets, and it took us probably a whole month. And there was, I think, 15 of us, and we went out in like little teams of, 4. And we had one person who spoke one of the major languages besides English, and then someone maybe who only spoke English go to each house. But we always had someone nearby. Like I was with our friend Carlos, who can speak Spanish and English, but right across the street was Reverend Merland, who speaks Haitian Creole. So if we went to somebody's house and they spoke Haitian Creole, we could just yell to Reverend Merland and ask her, she could come over and talk to them. So where the whole, like, don't be afraid to step outside the office and get out there, it's exactly what Edwin is saying, like, go to where people already are. Don't expect them to come to a community meeting or something because they're, working 2 and 3 jobs and don't have childcare. Go to them.
And this is Jamie. I'd really just emphasize the importance of building relationships. What we've talked about Everett being a real changing demographic population, but there's still very large population as well that has lived there and has deep roots and family roots there. And so building and making time to build relationships with those folks, you never know what they could lead to. And so there's some folks that, go back all the, through history into, elementary and high school that are now different leaders of organizations and businesses, and those relationships can really open doors that you never would expect if you do it right. And building relationships takes time, and I can't emphasize that enough. It does a lot of this work. Change does not happen overnight, but really through commitment to a partnership throughout the community.
That's such a great place to sort of pause here. That's great, Jamie, and Kathleen and Edwin. Thank you so much. You've given us some recommended sites that you use in your work. I'm going to now turn us to some of the questions from our participants, and I'm going to just see if, Mary, we can queue up some questions for our presenters here.
Yes, it's Mary here, and questions have been pouring in, and a lot of them around engagement. And I know you've highlighted about meeting people where they are and building relationship. But we have one person asking if you'd share strategies for building coalitions across diverse communities in one city, if you have additional strategies that you would recommend. Or is it really building on what you've already said?
Edwin, do you want to talk a little bit about how we've built One Everett, or?
Sure. I mean, I think that for us, because there had been unintentional relationship building for a number of years, because of the work of, the Cambridge Health Alliance, the work that La Comunidad, the Everett Haitian communities have been doing. I think it was natural at some point, to keep seeing the same faces over and over. And and I think one thing that was clear for me at one point, it's that we kept talking about, in some cases, policy. We kept talking about decision making. We kept talking about issues without putting a human face to those issues. And I think these relationships and conversations and dialogues with different service providers, different groups that were interested in raising the minimum wage, groups that were interested in protecting public education and resourcing it in the way that we should, talking about youth homelessness, we realized that we needed to come up with something that not only, helped us, reach out this different, sectors of the community, but also to try to, come up with solutions together. Because we couldn't, create solutions for one thing without, living this other issues around and, on the side, but we had to think of a way of how do those issues interconnect with each other, but also how do we as residents in the city, create strategies to address them. And I think that's what's led to the creation of this umbrella, coalition that we now name One Everett, because that's the vision that we have. We should have a strong, vibrant, One Everett, where we all have a decent way of living, where we all, relate to one another in a way that supports and builds, the kind of community that we want.
And this is Kathleen. I just wanted to speak a little bit to kind of the equity of building coalitions and collaborations, and what we've learned kind of about like different roles of different organizations. And if we have, say we have BlackCommunity.inc, which is like the cornerstone, community service provider in the community for Latinos, and we have the Everett Haitian Community Center, which is really the cornerstone community organization for Haitians, and they are stretched so thin. And then you have, these other organizations that are more resourced, and they've been in the community longer, and it's really our responsibility. And I say our because, I work for Cambridge Health Alliance, and we're a bigger organization and we have more resources. So I know that when I'm, setting up a meeting, or if I want to get, folks around the table who may not have the time to actually be around the table, I need to make phone calls. Email doesn't always work. I need to go to their office and actually talk to them. And, it's not an equality thing, it's an equity thing. Like, you need to understand your role and understand the roles of people around you too. And we talk about that, as a collaborative, and it's important that some organizations, you might need to reach out to them 3 and 4 times to make a decision on something, but that's fine because they're worth it,
This is Mary again. These are really great insights. I just, the wisdom with your advice is fabulous. And some people are also asking about specific ways that you then bridge your excellent work in terms of building these partnerships and the coalition to getting people engaged in policy work. And what are you doing to really use that then to do systems change and policy level changes and interventions?
Jamie, do you want to talk a little bit about youth specific?
Yeah,
so and how that kind of trickles up.
Yeah, so a lot of the things that TISA has worked on over the years has been around policies that impact youth health and community health overall. And so we are connected at the state level with other youth groups and our Department of Public Health around tobacco, around other substance use pieces, and also around some other just general youth-focused things. And so the example is that, young people look at the data, they see the data, they don't necessarily always agree or believe, but they begin to understand where it comes from, and looking at the trend data and saying, well, why is it that our pharmacies, if they're supposed to be a healthcare institution, are selling something that's making us sick or can make all of us ill, and are also preying on young people to become tobacco users. And so that continuously comes up in our work over the years. No matter how much work we've done, there's always another angle that tobacco companies have targeted young people in our communities, and particularly for them to understand communities of color, low-income communities, and and under 18 populations. And so they begin to figure out ways that they can advocate and make change and not have to be okay with the status quo. And so coming up with a policy around banning tobacco sales at our pharmacies was, you know, this aha moment, and who knows? And so they schedule a time to go before our Board of Health, and then there's just kind of this domino effect in terms of understanding that youth access to some of these products might need to change. And so there's been work around access for tobacco, for alcohol, that youth start the conversation and engage with other youth and seeing what's happening maybe on a state level or nationally, and that doesn't have to stay this one way or another in our home community. And so now there's a big push around changing the age restrictions for tobacco. They've done a lot of work around e-cigarettes, which didn't have an age restriction, and knowing that their siblings can have access to these things if we don't do something about it. And so they really care and can really get engaged when you start to kind of play with fairness and unfair. Young people really, we hear that all the time, right? That's not fair. And so they use that to their advantage in making policy changes that can be really positive. Another thing, just engaging young people, I think is really important, is if there's any time that you can pay them as a little bit of a bait to engage them, but this really addresses some of the economic pieces and a focus of our work. So even if it's a, you know, focus on substance use prevention, we know that employing young people, even if it's just a small stipend on a yearly basis, can have meaningful impact and also a connection to the work and feeling that they have even more value. And that I know that our youth are not spending it just on you know, snacks after school, but buying new shoes or school supplies, and that can really help alleviate some of the stressors in the family just on basic costs. So that's what I got.
Well, again, this is Mary, just excellent, excellent advice. And we just have a couple of minutes, and again, we're going to be doing the after chat once we close the official webinar. But one question that has come up, if it's something you can answer quickly, have you successfully used social media and technology to engage community members? And can you share some of those strategies briefly?
Well, I'll start. This is Jaime. Social media can be tricky. It's an ever-moving target in terms of what is trending and use. And I've found that we do have Facebook pages and a Twitter account. We put a lot of information out there. But what's really, again, going to engage people is those one-on-one conversations and being present in person. With our community, not everybody is online, and it might seem like everybody has you know, smartphones and whatnot, but a lot of our youth maybe have limited access even within that. So I can't speak to major successes, though we do partner with some statewide social media campaigns that have happened through one network called the 84, which is tobacco prevention focused. But in general, I can't speak to major social media successes, but it's important to be present where everybody is. So online is definitely a piece of it, but again, in person seems to have more impact on the relationships.
Well, this is Jan. Oh, sorry, Edwin, jump in.
Yeah, if I may, I think we have some relative amount of success in some of the local activities that we have created. You know, for instance, last November or before November last year, we organized a candidates forum for folks that were running for the city council, and we were very worried that we were not going to be able to attract, you know, all the candidates, and there were many of them, I think up to 21, 25 candidates that ran for the city council, because they were much more interested in going to an event that was put together, a fundraiser that was put together, you know, by the mayor at the time. And we had a Facebook event, and there was a lot of social media, and I think, you know, they realized that it was important to be at the forum. It was important to hear the concerns, you know, the constituencies. This new constituency, you know, had around jobs, around, homelessness, around, funding for public education, around, displacement, lack of affordable housing, et cetera, et cetera, et cetera. So I think, that was a little bit of a success. So much that now one of the things that we're going to start doing is trying to follow up now that some of them are in office, is to actually have those one-on-ones and say, we want to develop a relationship. We want to be able to advocate for the things that are important to our community members. And we expect you to, do the right thing because you promised all these things when you were campaigning. So I think we've had some relative amount of success with social media, given the limitations that we have that Jamie was talking about.
Thank you. Thank all three of you so much. And we are going to keep this platform open for about 15 minutes, but I want to wrap this up, and we would really like to point you all who are on the webinar back to our website and let you know we do have 11 community coaches based in Madison and regionally around the country, and our assistance, thanks to the Robert Wood Johnson Foundation, is available at no cost to you. So feel free to contact us through that Get Help button, which is throughout our website. Speaking of social media, here's how you can stay in touch with us, and please make sure that you're on our email list. We have updates coming through all the time, and these great webinars are announced that way. I would also like to acknowledge the amazing contributions of our team of partners, including those listed here. This would not be available without so many hands helping make this happen. Just turning back to the beginning of the webinar, we introduced this guiding question, and we hope that this discussion has generated some new ideas and thoughts about engaging and empowering community members in addressing racial and social justice issues. So we want to thank you all for joining